My name is Julie Sarton, and I am the owner and founder of Sarton Physical Therapy. Years ago, when I was in grad school, my late uncle, who was a well-known OB-GYN doctor in Mission Viejo, planted the seed. And he told me about this population of patients who were suffering with pelvic pain, and no one in the physical therapy realm was really addressing and helping them. Even though I have done this type of work for over 14 years, it is now just getting the recognition that it deserves. Pelvic floor dysfunction can range from pelvic pain to sexual pain to urinary or fecal incontinence, pelvic organ prolapse, pre- and postpartum issues, so issues related to pregnancy. We also recently have expanded out, and we've been working with patients after they've undergone breast cancer and post-mastectomy surgery, and we work with helping to release their scar tissue, and then also working with orthopedic issues related to the pelvis, such as SI joint pain or tailbone pain. I wanted an environment not only that was warm and inviting and safe, but I also wanted to ensure that the therapists at the practice had plenty of time to address complex issues that happen. So unlike other practices that will see patients in a 30-minute time slot, we have created a model to be able to treat and spend an hour with a patient, 55 minutes, almost an hour with each patient. We have 5 private treatment rooms that are set up. Each room has a theme and was inspired either by a patient or a person close to me. And then we have a general Pilates gym area that we have a unique pelvic floor Pilates program that's tailored specifically for patients both with pain as well as incontinence or prolapse. So currently we have 4 physical therapists on staff. 2 of us have achieved advanced board certification through the American Physical Therapy Association, and this is known as the WCS, and we are women's clinical specialists. The other 2 therapists that are part of our team are in pursuit of this degree. And part of what we wanted to create at Sarton PT was a gold standard of what pelvic floor physical therapy should be. Men suffer with the same issues. They have the same pelvic floor musculature as females. Unfortunately, it's really hard for men, though, to find the answers and the help that they need. So it's not uncommon that both women and men typically will see anywhere from 3 to 8 practitioners before walking in through our doors. So one of the conditions that we treat in our practice is called pudendal neuralgia. And pudendal neuralgia is a very difficult diagnosis to deal with. Most patients manifesting this cannot sit for more than 1 minute. So we had a wonderful patient that came in, and because of her inability to sit as an outlet, she decided to paint because she could do this standing. She now successfully paints on location across the world, and her work is sponsored in multiple galleries, including one in Laguna Beach, in Palm Desert, and even in Paris, France. So we have her paintings hanging in one of our treatment rooms, and that is called Vanessa's room. She thought your patients need something A, beautiful to look at, and B, they need to know that they can be inspired to get better. I think the most rewarding part is truly experiencing that success with your patient, seeing them get better, walking that journey with them. A lot of our patients have a long journey, and to be with them side by side and cross that finish line, there's no greater feeling.